Musculoskeletal medicine is woefully taught in our professional schools. Most students get a few days to maybe a few weeks tops of sports medicine education. Then, those who choose to go into primary care are thrust into clinic where up to a quarter of their daily visits are sports medicine related. As a primary care sports medicine physician, I was sick and tired of primary care clinicians not getting the training they deserve and in turn not being able to help their patients the way they'd like to. So I created MasterMSK to help clinicians become more confident and competent in their sports medicine knowledge. And so now I want to take you into the course to show you what it looks like, what's all involved, and how it's going to make you a better clinician. Let's get started. The number one goal here is to help improve your confidence, which will then help improve your patient care. And we do this through a comprehensive course. We make this comprehensive, but also concise. We understand you're in primary care, so you're definitely busy. But this should be your one-stop shop to hopefully get you very confident and competent in sports medicine education. And a lot of times, unfortunately, I have colleagues who say they hope nothing comes through their door that is related to bones or joints. And that is what I'm trying to alleviate here. I'm trying to take that away from you where you're not scared of musculoskeletal complaints, but you actually look forward to it because you understand it and you're able to treat patients very well. And one thing, maybe you're a residency or you're a medical school or something like that, and you are worried about your learners. This is a perfect tool for them to help get a solid musculoskeletal education that they can take with them in any specialty they go into, right? It's never wrong to have this information for anybody in any specialty that they go into. And so it's very helpful for any type of person, but this is focused on primary care. And that's the big thing. It is focused on primary care and it's practical. And it's a technique that I've used on hundreds of learners. At the end of the day, this is how I teach all my in-person learners these concepts because I know what demands in primary care, right? I am a primary care doctor by trade. And so I'm able to understand like what is realistic. A lot of times you'll see videos or content saying, do this, do that. And then all of a sudden it's a 20-minute exam. We understand that's not necessarily practical for primary care. So this is coming from the lens of the primary care physician. How do we do this for you? So that's what we're thinking about. And how do we do this? Well, it's a step-by-step guide to kind of walk you through things. We are going to help you gain the confidence to see anything. We start with functional anatomy. So a lot of times what we'll do is start with functional anatomy, nothing huge. We're not going super in depth, but we'll do some anatomy and make sure you understand the region because that's super important for all things orthopedic. Then we'll take you through physical exam tests, right? Because it's very important to have a solid physical exam. If you have a good physical exam, we can start to understand what's going on. And once we have that physical exam, we can then build our differential and work through various differentials and how to build a robust differential for the complaints that you see. So really, that's what we're going for here. And you might be wondering, well, how does this actually look? Next, let's dive into what it actually looks like when you get this course. And so this is the dashboard right here you get when you log in, and you just click right into it and it'll take you to this module page. And right here you can see 125 and growing. We're adding more and more hopefully every month of videos and lessons. So this is going to walk through a pretty comprehensive approach of going through things. Right now, the big foundation of modules is going through an introduction, but then we're going joint by joint. So what we mean with that is we essentially have modules on the shoulder, elbow, hand, wrist, back, hip, knee, ankle, injections. Those are our core modules, and we have additional topics on top of that as well. But we walk you through each one of those in different fashions. And so let's just show you here what it actually means. So let's take shoulder, for example. Here we have the anatomy, exam over, how we go through an exam. Then we go about specific pathology inside the joint in terms of how to test for it. So this first shoulder exam module, this entire module is all about how we examine them. And then paired with that, we have the shoulder clinical considerations where we go into the differential. So let's just click into one real quick. Let's go right here into the shoulder anatomy. What happens here is when you click in, this is how it's presented. We have the play button here. And yes, you can speed this up. You can go up to 2 times speed. I understand that. As someone who works at 1.75 speed on everything I listen to, I get it. No worries. No offense taken. But this is how it delivers it here. We have explanation, kind of hopefully objectives of what we're learning in the course. And then down here, we have comments. If you have questions or comments, you can place them there and I'll go through there and answer those as well. And so that's the general gist, and you can mark as complete so that you understand and can track your progress. As you can see here, the progress bar. And this is an easier way to look at it. This is just specifically in this module. And then if we back out here, we get down at the end, there's a shoulder exam quiz, and each one should have a quiz, about 4 to 5 questions. What it is just kind of testing your understanding, right? It's not necessarily a necessity that you have to get 100% on those, but it's just kind of help your understanding, make sure you're hitting the big topics, and kind of there's some selected topics throughout. So there's quizzes for each one of these involved, and I think it's really helpful. That's the goal, is to help solidify, right? It's one thing if you just learn information, but we want to learn information and then be able to, put it into practice, and that's what those quiz questions kind of help with. And then if we go back here, this goes through all of them here. There's shoulder, there's going to be knee, hip, all of them, and yada, yada. We're just going to go through and through. As you see, we're just scrolling on, and that's essentially the course. And you can go at your own pace. This works it's mobile friendly. You can do it on your own computer, whatever it is. It's all hopefully as easy as possible for you to do. But the goal is you work through these modules at your own pace, and answer the quizzes at your own pace as well. But there's a comprehensive goal. And the reason I broke up so many modules is because I want you to be able to find this easy. If you're in clinic and say, oh man, I have an AC joint coming, I don't remember that, you can boom, AC joint testing right there. You can or maybe the glenohumeral joint right there. It's easy for you to search and find. That's like my big thing is you can navigate this easy and find what you need to. So next I want to cover some FAQs about the course. And the first is, what does this course cover? And it covers quite a bit. As we talked about, the big thing are these anatomic locations. So we start shoulder, elbow, hand, wrist, back, hip, knee, foot, ankle, and then injections. Those are the core modules, but we're having an ever expanding library. As we continue to build this, we're gonna add more and more topics. So it's gonna be growing, evolving, and updating. As new evidence comes out, we're gonna continue to update that. So that's what it specifically is covering. How long do you get access for that? Well, the easy answer to this is that you get it forever. I think I'm a big believer in that. What good does knowledge do if you just have access to it once, right? We want to have this in forever. And so this is something that you're gonna be able to look back on. And if you have questions, you can go there, have it. So it's a one-time price only. This is no subscription model. We're just buying it and you have it forever because I want to get this out to as many people as humanly possible. I believe in it so much. And what is this, who's this course designed for? And I mentioned before, this is specifically for primary care, but it can be like anybody who sees musculoskeletal conditions. This can be primary care. This can be students. This could be physical therapists. This could be anything. And really, anybody who's seeing musculoskeletal complaints, this can be aimed at them. But specifically, this course is made for the primary care clinician, just so that we understand there's unique constraints in that. So that's what we're looking at there specifically. And then finally, we have what comes included in the course. And like we mentioned before, that's going to be over 16 modules of content, corresponding quizzes, and ever expanding library as well. And so hopefully you found that helpful, but at the end of the day, all the material in the world is worthless if you don't actually put it into practice. And so my goal is to make this as practical as possible, understanding the constraints that primary care has, so you can use this, learn from it, and then implement it and help improve your patient outcomes. That's the number one goal. And so if you want more information about this, please click the link below in the description. It'll take you to my website and you can get started. If you have any questions, let me know. From a pricing perspective, if you are an educational institution, if you're a residency, a medical school, or something like that, please contact me. We have steep discounts because I want to get this to as many people as possible in primary care. Thanks so much, and let me know if you have any questions.